I'm Lesa Silver. You guys already know me. So I was in human resources, of course, for almost 30 years. So for almost 30 years, I was assisting employees and others with health insurance. So I have a background that kind of fits with this. Do I know everything about Medicare? Absolutely not. But I do have a background that kind of fits with it a little bit. And I'm volunteering with the SHIIP program. And the SHIIP program, this is the first brochure that you have in your little package. But it's got, so hang on to this also to look at it later. It is an introduction to the program, but it's also got some other valuable information in it about some contact information, etc. But this is a program that works with the North Carolina Department of Insurance, and so we're blessed by them. All the material is blessed by them. SHIIP is the, I always make sure I say this right, Seniors Health Insurance Information Program. And the goal of this, again, you can read all of this in here, but the goal of this is to help those that are nearing retirement or even in retirement and trying to make decisions. It's to try to help you navigate Medicare. Because even if you've been in the system for a little bit, it's still can be a very confusing system. So you're not alone, and that is the reason for the SHIIP program, and that's the reason for this seminar, Medicare 101. The SHIIP program has an office in Raleigh, and they have counselors there that can answer your questions. And we also have some regional support that's very supportive of Dawna, who is our local SHIIP coordinator. Now that's just one of Dawna's very many hats here at the Senior Center. So one of the reasons that I'm here and that I'm volunteering is to also provide some support for the program, as well as to the Senior Center and to Dawna, to be able to have this on a regular basis and hopefully get the word out. We are not affiliated with any insurance companies. We are not here to sell anything and never will be. The whole goal of the program, as I stated before, is just to help you hopefully navigate the system and understand Medicare a little bit better, and also to get you tagged with other resources that are hopefully easier to understand, that will help you also as you go through your journey and you run into other questions. Now, Dawna and Wayland are the prevalent contacts here at the Senior Center, but they do have some additional support, and we'll talk a little bit more about that later, because there's some things that they can do here that are very, very valuable and helpful to the citizens of McDowell County. But again, you also have other resources here, which includes the state office. So you can always pick up the phone, and this gives you that information in there. And again, I volunteer because of my applicable background, but hopefully to also alleviate Dawna. It's very rare that Dawna gets to set in. So this is Dawna Ledbetter from the Senior Center. Again, she's the local SHIIP coordinator as well as many other hats here. And she is welcome and free to interject, and she can more thoroughly answer a question. So we'll welcome her participation if that comes up. Waylon Preber, that I mentioned earlier, is the director of the Senior Center, and he also, I don't think his involvement is certainly not as extensive as Dawna's, but he provides some valuable support to the program as well and can be assistive. This is Medicare 101. So what 101, of course, you realize means that it's fairly elementary, if you can call anything about Medicare elementary. So our goal is to try to help give you a little bit more knowledge and some nuggets that may not mean a lot necessarily today, but if your situation changes or as you go through your journey again, something might stick with you to go back and say that there was something said about that, and I've got material and resources here that I can refer to, or come back to another seminar, or call, or. So what we are covering today again is Medicare 101. And what we're going to be looking at is what is Medicare and who is eligible, the 4 parts of Medicare, A, B, C, and D, and programs for people with limited income and resources. One thing I do want to talk about on this slide in understanding Medicare is one of the things that I have found so confusing on my journey up toward Medicare is hearing about, oh, well, that's Medicare Part C. Well, that's D. Have you taken care of your Medicare Part D decision yet? And you're saying, what? What are you talking about? Medicare is Medicare. But this is the lingo that they use to refer to the different parts. And so we're going to be describing those. But once you get your head kind of wrapped around, well, when they're talking about, I mean, even physicians, insurance people, anybody that you talk to, when they're talking about Medicare D, then they're talking about the piece that is totally prescription drug focused. And we'll touch on that and hopefully break that down a little bit better, but that's how you're going to hear it out in the Medicare world. Instead of prescription drugs, like you would think that they could just say that, it's going to be Medicare D. So we'll talk a little bit more about those things. So what is Medicare? Medicare is individual coverage. It's not like the private plans in that respect, because in that respect you can have, in the private world, you were able to say, I want me and my spouse, or I want me and my family, and then you all were on that exact same plan. And it was processed that way. But Medicare is only about you as an individual when you're making those choices. And one of the things that you will discover as you're making these decisions moving forward, that is what is right for you is likely not the exact same thing that may be right for your spouse or your loved ones, other family members. You may have this wonderful prescription drug plan that you love and it fits you just fine, and so you're trying to tell your neighbor about it. You need to look at this one. They do need to look at it, but what's fitting you is not necessarily fitting them. So it's all individualized. And that's another thing that also makes it a little bit confusing. But if you recognize that, I need to find out what's best for me and my personal situation, then that's helpful. Medicare is an insurance plan that you are familiar with in your work histories, when you're thinking about deductibles and co-pays and separate premium for this, etc. So it does operate that same way. It is an insurance plan. It's just individual, related to you as a person. So you are going to experience, even with your choices, your variety of choices that you have, you are going to experience co-pays and out-of-pockets, etc. Original Medicare, you'll hear it termed that way sometimes. Original Medicare is A and B. And I want to go ahead and pause here. I want to introduce to you one of the brochures because this helps me so much. And we're going to have another visual on this in the back. But on this, in this handout, Medicare Basics, it has a visual on the back that I have referred to many times. So it talks about, you will see original Medicare, and it refers to Part A and Part B. And again, we're going to break that down just a little bit better. Am I getting into the slide? Yeah. But this visual is very helpful to me. So hopefully it'll be very helpful to you, and we'll refer back to that again. So original Medicare is referring to Parts A and Part B. The Medicare program, it has many different products under their umbrella that work together in different ways depending upon how you combine them. And you can just tell by looking at that visual that there is some little bit of combination choices that you can make. And again, we're going to talk about that more, so don't let me confuse you too much. You still have the concept, possibly, of primary and secondary insurance coverage. If you've been familiar with that in the past with your family coverage, and your spouse happened to have one, and you recover on that too, then you knew that yours was primary and theirs was secondary. which means that yours pays first, and then if there's some things left, they may address that then. So you're still going to be dealing with that concept as well. So just understanding and remembering about your family coverage is very helpful to also relating that to the Medicare program. There are a lot of products in the Medicare umbrella, or under the Medicare umbrella, that are sold by private insurance companies. So depending upon the choices that you make, then you may be dealing with some private insurance companies as well as Medicare, which when I think of Medicare, I think, governmental. So there's also the strong possibility that you're going to be dealing with some private companies as well, depending upon your choices. So again, we're going to be talking about more of that in the presentation. So who's eligible for Medicare? Medicare eligibility traditionally begins at age 65. There are some situations that someone may qualify for Medicare prior to age 65. It is fairly limited. If you've been awarded Social Security for some sort of disability, then you may be eligible already for the Medicare program or be within it. But anyone that's over age 65 and you've participated in Social Security, the Railroad Retirement System, or employees of federal, state, or local governments whose spouse has participated. There are the Lou Gehrig's disease situations and those that are in the end-stage renal disease. So that may not apply to you, but you may have a cousin or a neighbor or something that you know is in one of these situations. So this is one of those things that I think is a nugget. Again, it doesn't apply to you, but it may apply to you later, or it may apply to someone that you know. And just remember that there is a possibility for them for some Medicare coverage. Medicare is not related to your decision to retire. You can retire at various stages depending upon your employer and your employer benefits, and you make that decision. That doesn't automatically trigger Medicare. Medicare's triggered traditionally by your 65th birthday. And again, those that choose to do Social Security retirement benefits, those can begin as early as age 62, but you're not making a Medicare decision at age 62 just because you took Social Security. They're separate. Again, we talked earlier that I told you that we have the 4 parts of Medicare. We have, and this slide illustrates, and the little icons that they have hopefully, kind of help a little bit with that too. Part A is your hospital coverage. Part B is your medical and your outpatient type services. Part C is Medicare Advantage plans, and that's the big scary thing in the room sometimes, because that's a newer thing and it's a little bit confusing. Again, we'll talk more about that. And Part D is the Medicare prescription drug coverage. So we'll be talking about these 4 parts. Okay, so original Medicare, what does it cover? This slide illustrates Part A on the left of the slide, Part B on the right of the slide. And again, Part A is what you normally think of as your inpatient hospital type expenses. So that's what Medicare A covers. Medicare Part B, traditionally people do take Medicare Part B, but that is a choice, that's a choice that you will make, and we'll talk more about that. This slide gives you a general illustration of what Part A and Part B covers. In the Medicare Basics, the same brochure that we were looking at before, that you'll be taking home with you, it also gives, let me go this way, it also gives the page 2 and 3, you've got this chart. And the first page here tells you Medicare Part A hospital insurances, and it talks to you about the coverage that's underneath Medicare Part A, what the benefit is for that, and it also talks about what your payments are for those items. Now you'll notice you will know, it's printed on here, that this brochure was printed, it says 2017. All the information in here is still valid and good. The government's saving money and not reprinting these until they're needed. The biggie that is different in here is the dollars. So you also have in your package this sheet. So when you look at the chart on Medicare Part A and you're looking at inpatient hospitalization for the first 60 days, it says Medicare pays all but this deductible. And if you will look at Part A hospital insurance on the sheet, the deductible is now $1,364. Now this is your 2019 rates. Okay, so on the chart it says 1,316, and the figure is actually replaced by this page. So hopefully that's not too confusing. Just know that this is a valid handout. You just need to, if you're really zooming in on your numbers, then you'll also want to look at this sheet so that you can understand what your deductibles and your co-pays are. But just as you would expect, Medicare Part A is your inpatient hospital coverage, skilled nursing facility coverage if you come out of a out of a hospitalization event. You may need skilled nursing care. If you're coming from a hospital event, then it is part of Part A. If you need skilled nursing care not coming right after a hospital stay, then it would be Part B. So that's one thing that's a little bit confusing, and you're not going to remember that necessarily. But if you come into a situation where skilled nursing care is something that's mentioned or recommended, then hopefully you'll have that nugget and you'll understand that it would be processed under A in this situation, under B in this situation. And this chart's going to also help with that. One of the things that I think this chart is really helpful with when you're talking about Medicare Part A coverage is it gives you the breakdown on your benefit from Medicare based on your length of hospital stay and the event. It's called the inpatient benefit period versus your annual deductible. And I know that that's confusing. It's confusing to me, so let me put it that way. It's a little bit confusing to me. But it's important to go ahead and recognize that it is two different things, because your inpatient benefit period is related to an admission to the hospital. And an admission for a certain condition. So your benefit period, even after you're dismissed from the hospital, if you're back in the hospital within 60 days, then for that same type condition, then your benefit period, you're still within that same benefit period. Again, I know this is a little bit confusing, may not ever apply to you, but it is something that we like to introduce so that you'll know that there is some differences based on your length of stay in the hospital and the whether or not it's separate reasons for becoming a patient. So just to know that and be able to check your resources if that if you're going to have multiple admissions in the hospital.
And you could pay your deductible more than once in that scenario. So
In that, yes.
So if you're enter into the hospital and it's a true inpatient stay, and say it's a week, and then you come out of the hospital and then you go back in within that 90 days, then you wouldn't have to have another deductible. But if it's another 90 days passed and then you have another inpatient stay, then you pay your deductible again, and then you have another 90-day window of time for admissions into a hospital. So like she said, it gets really confusing And a lot of people don't understand that, but sometimes you can pay that Part A deductible more than once throughout the year.
In a year. Again, that's something hopefully that you'll never encounter, but if you do have multiple hospital stays, it's valuable to remember that you might have that responsibility. So on the page 3 in this handout, it does talk about Part B, or it gives you a chart that also illustrates Part B coverage of Medicare, which is generally physician services and outpatient services. So if, when you're talking about, I'm going to go see, I need to see a dermatologist or an orthopedic specialist, et cetera, then the Part B coverage is what applies. And of course your family physician, your routine type services that are on an outpatient basis. There are also certain situations that you're actually in the hospital overnight that the claim is processed as a Part B claim. And to me, that again, is confusing because you just think about, well, I'm in the hospital. So I'm up here. My claim is up here. But it truly does depend upon your situation and the coding that the hospital does for your situation and the types of services and treatment that you have. So there are situations when you're physically in the hospital, perhaps even overnight or a couple of nights stay, that your claim would be processed in the Part B category. Just again, another nugget to kind of take with you that you'll know to look back upon and hopefully prepare yourself a little bit better about what you'll be dealing with financially if you have those services. The physician services that are provided in a hospital setting, they are billed separately under Part B. I have found that in my professional life a little bit confusing sometimes to explain to people because they're saying, I was in the hospital, I've already paid my hospital bill, and I'm getting this bill from Dr. So-and-so from Timbuktu that I've never heard of. Well, there is the very likelihood, not always 100%, but there is the very likelihood that they did render services that you are liable for and that they do bill those separately. Physician services and in hospital stays, they do have those billed separately. Those will be covered under Part B. We'll talk more about this later, but it is always wise to check out any bills, that invoices that you receive or anything that appears on your Medicare explanations. Make sure that it is legitimate. Part B does require a 20% copayment, and you do have that major out-of-pocket exposure. So again, that ties right back to understanding what you had when you were on insurance in the private sector or your previous work histories. Okay, some things that are not covered by original Medicare that point out because sometimes there have been misunderstandings. You do not have outpatient prescription medications under that original Medicare Part A and Part B coverage. So that is a choice that in the Medicare world that you're going to have to make. Whether or not you have another resource for your prescription drug coverage or whether or not that's a purchase that you're going to need to make. Not covered under original Medicare Part A or Part B. It doesn't cover routine dental care, vision care and eyeglasses, hearing aids. These are not covered under original Medicare. We are going to talk about some Medicare Advantage plans later when we talk about that Part C, where you can have an opportunity for some of these if these items are important to you, as well as the prescription drug coverage. But if you have Medicare Part A and B, then those things are excluded. What does it cost? Most people most of us qualify for a premium-free Medicare Part A. That's the original Medicare, the inpatient hospital coverage. If we have contributed, and most of us have an equivalent of 10 years to the Medicare system through the Social Security tax that have been withheld from our paychecks, either by us or by our spouse. There are situations that some people have not contributed for that equivalency. If you have any doubt about that, and I don't think anyone in this room has any doubt about that, but for someone else that you know that may have doubt about that, they need to contact Social Security. Now, we get those annual Social Security statements that are illustrating that to us and giving us the comfort level that they've given us credit for all those years that we've worked. But if anybody has any confusion about that, whether or not they're going to qualify for premium-free Part A, then they would want that verified by the Social Security system. Part B, the standard Part B, had a monthly premium for 2018 at $134. So again, B is a choice that you're going to make, but we're going to talk a little bit more about the value of that choice. But there is a premium that is deducted from your monthly Social Security retirement benefit to pay for Part B. And again, that's a choice that you'll make. There are very few, I'm sure here in McDowell County, that the statement on this slide that if you're single and your income is more than $85,000, or if you're married and your income is more than $170,000, then you may have to pay more for that monthly premium. But if any of you are in that category, just be aware you may have to pay more than $134. Well, and that was the premium for 2018. The premium for 2019 is on this sheet that I told you that had the dollar figures earlier, and that's going to be $135.50. So again, you'll discover, I'm not going to say that the premiums, etc., go up consistently. That was a question that I had in one of the sessions that we did. But remember how your family coverage that you were paying for, every year it was trying to find out whether or not you were going to have any changes to the plan, or the cost or the out-of-pockets or deductibles, etc., were going to be affected, your premiums, etc. The same thing still applies in this situation. Hopefully you won't have changes annually, but there is that possibility. So Medicare Part B monthly premium is changing slightly for 2019. There is the possibility that you may qualify for some financial assistance paying Part B. And there is a handout on that, and we'll talk about that again in just a moment. But again, I just want to point that out because that's another one of those nuggets that I keep referring to. Because you may know that you're not in that situation, but someone that you love may be, and you can point that out. Or our financial situations can change dramatically when we retire. Maybe not at first, but depending upon life circumstances, it can change. So it's always good to know I can get some financial assistance with Part B if I fall into this category. And again, the handout will illustrate, we'll talk about it. There are some instances where there's some automatic enrollment into Medicare, and I mentioned earlier, if you're already collecting Social Security retirement benefits, and generally that's in some sort of a disability situation. These situations described on this slide, they're automatically enrolled in original Medicare. And then they'll make a decision about if they don't want Part B, if they're automatically enrolled, then they have to notify Social Security that they don't want it. So there are some instances where there's automatic enrollment into Social Security. This also mentions that if they were automatically enrolled, that the coverage begins on the first day of their birth month, unless the birthday is the first of the month, and then it begins on the first of the preceding month. So right now, if your birthday was October 1st, your coverage would start September 1st. If it's October 2nd, it would start October 1st. That's just an example. Okay, so I mentioned earlier the enrollment periods. Sometimes the verbiage on that can get a little bit confusing, because we're going to be talking about other enrollment periods as we go through the session. But your initial enrollment period, when you hear that, that is referring to when you are initially turning 65. When you're turning 65 and you're not already in the Social Security, the Medicare system because of of a situation that was like on the prior slide. So if you're turning 65 and you're not in that situation, you actually have a 7-month period that's called your initial enrollment period. And it's 3 months prior to the month of your 65th birthday, the month of your 65th birthday, and 3 months after. And your effective date for coverage is going to depend upon when you enroll. So obviously, if you take care of your initial enrollment during the early stage of that period, the first, second, third month, then there is the possibility that you will have coverage the first day of your birthday month. If you enroll into it after you've turned 65, then it would be the first of the month after that. So after you've enrolled. So, but you do have that window. And it's good to know that you have that window if you've not been able to get all of your questions answered in order to get that enrollment taken care of right away. But your goal is certainly going to be to try to get your decisions made and enroll early in that initial enrollment period. So initial enrollment period is tied to your 65th birthday. There's also a general enrollment period, and this can be for somebody that just didn't enroll in Medicare. They turned 65 this year, but they didn't do the initial enrollment. The three month window after their birthday has passed. Well, it's not like I'll never get another chance. You do get a chance every year. There is a general enrollment period, and there is that opportunity there. And it begins on January 1st and ends March 31st. The coverage during this period, if you do a general enrollment, is effective July 1st of that year. But it's important to understand that if you don't enroll in Medicare when you're initially eligible, then you may face a 10% penalty on your premium for the rest of your life. And that may not sound like a lot, like 10% right now to the $135, $13.50 additionally every month. But that does add up. So you just need to know that, be aware, and make a conscious decision about that if you don't enroll when you're initially eligible. There is, and we're going to talk a little bit more about it, but there is an exception if you are covered under an employer group health plan and you don't want to take Part B when you originally qualify based on your 65th birthday. There is a special enrollment period. So we've talked about initial enrollment period, we've talked about general enrollment period, and there are certain situations where you can have a special enrollment period. And the special enrollment period would allow enrollment without the penalty. So the special enrollment period, if you are actively working or your spouse is actively working and you're covered under some insurance through them, then you are able to delay enrolling in Medicare Part B If you're covered by health insurance. If you're actively working and you don't have health insurance, then this does not apply. And there could be that situation, of course. But if you have health insurance coverage, then you can delay your decision, because having an employer group health coverage and Medicare Part B at the same time does not buy you additional coverage. They're not going to work together. And again, there are certain situations where you may be working but not be covered under health insurance. So you just, again, this is where it comes into your individual situation. And that's why that's so important, because they're not all going to be the same. If the employer is the first payer on claims, then you would want to enroll in Part A and delay enrollment in Part B. And that's when we're talking about primary and secondary coverage. And your employer group health coverage is going to be your first payer. So you will have the opportunity to pick up Part B after you stop working and retire or come off of your spouse's plan without penalty. But you're going to have a special enrollment period, a time to do that, and that is 8 months. So when you come off that plan for the variety of reasons, then you have 8 months to enroll in Medicare Part B without penalty. You can still enroll in it later during the general enrollment period, but there will be penalty on your premium for the rest of your life, or the rest of the time that you have Part B. It's also important to know that it's necessary to enroll in Part B. It's not automatic. You have that period of time for you to make sure your Medicare Part A is lined up and you have coverage. You need to pursue that. And you also need to pursue and make a conscious decision about Part B. Nobody else is going to handle that for you. That's an action that you'll need to be prepared to take. So again, once you come off of an employer plan or your spouse's plan, etc., then you're going to be making a decision about Part B at that time. You're also going to want to consider whether or not you want Part D. We mentioned earlier that's the prescription drug coverage at that time. With Part B, you have that 8-month window after the loss of coverage to enroll. The sooner you enroll in it, of course, the sooner your coverage for Part B could begin. It's important to remember, we're going to talk more about Medicare Part D, but it is important to remember that the window of time you have to enroll in Medicare Part D, the prescription drug coverage, is 63 days. So once you come off that employer group health plan and you've lost your prescription drug coverage with them, you're also going to want to make a decision about whether or not you are going to take Medicare Part D. Again, you can make another decision about that later. You can make a change later. We're going to talk more about that. But initially, so that you don't have a penalty for the rest of your life while you're on Part D, then it takes that enrollment in it when you're first eligible or during this special enrollment period. So you becoming straight off of another group health plan and making these choices. That's when you can do it without penalty. So how do you enroll? And I just said, it's your responsibility. So you can do enrollment for your Part B. You can do enrollment for that Part B at the website. You can call this toll-free number. And you can also make appointments and go through local offices. I know that there was an office in Hickory. I'm thinking there's an office in Asheville. But the thing to remember is, don't just show up. Because some Social Security offices focus on certain things. And if you show up without an appointment, you're liable to either not be seen that day or they're not doing what you need at that office. And they're going to appoint you somewhere else. So if you'd like to do it in person, you may. Just call and get an appointment and make sure that they're going to be able to work with you for that appointment. Okay, so now we're going to talk a little bit, and this is a good time to look back at this visual for a minute. Medicare supplement insurance, and that's on this part of the visual, this part of the chart. A lot of times, prior to doing this session and hopefully getting a little bit more training, I would get Medicare supplements or Medigap coverages confused with the Medicare Advantage. And this visual helps really illustrate for you that the Medicare supplement insurance or the Medigap coverage is not related to that whatsoever. What these plans are insurance plans that fill the gaps that you may have when you have Medicare Part A and Part B. You've got original Medicare, you've made that decision, and this is what I want for this point in time, is Medicare Part A and Part B. Do you need a supplement? Do you need and desire a supplement that will help fill in the gap, and it will help you with the co-pays and the out-of-pocket expenses that you are going to have for the claims that you experience on Medicare A and B. Medigap plans never pay your Part B premiums. That $135 that comes out of your Social Security check that will pay for Medicare Part B, that's not covered by this, and there's been a misperception of that in the past, so we like to point that out. So this is a personal decision, and this is one of those situations where if you want this, then you're going to be purchasing that and dealing with an agent, or you can do this online. You can do your shopping, you can check this out. One of the good things about these supplement plans is that they are standardized. And in this handout, on the 4th page, there's a really great graphic, this chart, that illustrates for you these standardized plans. Now again, this is if you decide that you need a gap plan, something that helps you pay those other out-of-pocket expenses. These plans are designated by these letter codes up on top. A, B, C, D, F, G, K, L, M, and N. Every Plan A is the same, no matter where you buy it. I mean, it's got the same standardized coverages. And this chart will illustrate for you that every Plan A will help cover your co-insurance and hospital costs for your Part A Medicare, original Medicare coverage. Every Plan A will provide coverage for blood under the Part A and Part B need for blood. So this is just a graphic that illustrates that for you. So if you decide that you need a gap plan, a Medigap or a supplement plan, then this is just a brief way for you to say, well, this is what I really think that I would like to have. I really think that that either a C or an F might meet my needs. You know, I might really like these. No matter where you go, if you go to ABC Company or you go to Farm Bureau or Nationwide or Blue Cross Blue Shield or any companies that offer these, everybody's Part A or, A, B, C, D, they're going to be the same. What's going to be different is that they are going to have different premiums. Their premiums can vary for that. So one company's Plan C may cost $150, and another company's plan may cost $170 or $200. But the basics of what they cover are going to be the same. So you would probably want to understand in that instance then why does yours cost a little bit more? Because they do have the capability sometimes of having some add-ons to their plans. They've been referred to as innovative riders because they can have things, they may have some vision coverage. They may have some dental coverage. They may have some coverage for you to pay for a gym membership or YMCA membership, etc. So they may have something additional, or they may not for that additional premium. So that's just something that you're going to want to understand and make a conscious decision about if you're shopping for a Medicare supplement policy. An important thing to understand with that is that the government is requiring that they have these standard coverages. So if they have something extra that they're selling you, then they can take that away. They can discontinue that, or they can even charge a little bit of an extra premium for that. Well, just for $10 more a month, you can add this vision coverage. And next year it may be $20, or it may be $10, or next year they may do away with it. So it's just good to know that, but you can always make decisions and change your supplement coverage if you choose. So that is something that is up to you and that you can change at any time.
Can I interject? I know on those Medigap plans, like she said, you can change those at any time. There's not like an open enrollment, but after your initial coverage period, which is the year you turn 65, later on if you decide to switch those Medigap plans, they can do underwriting and they have you answer questionnaires and things of that nature. So you're not guaranteed issuance into a Medigap plan after you're past your initial 65th window of time. So that's just something to be mindful of.
So a good point with that, if you think you want to switch plans, just make sure that you're going to be able to transfer on another plan without health questionnaires. Does that make sense? In January of 2020, and I don't want you to get overly concerned with this, but do feel a responsibility to point out, in January of 2020, newly eligibles, they're redesigning a little bit, and newly eligible people for these policies, for these supplemental policies, will not be able to purchase C, F, or F prime. And F prime, it tells you down here, has a little bit additional benefits. There's an asterisk there at F. Now they may replace it with something else. You can tell by looking at this chart that that at one point there was probably a plan E, and there's no longer a plan E. But they may have come up with plan M at that time, and I really don't know exactly that history. So we don't know whether or not that they will replace those plans exactly, or a little bit richer or a little bit less rich. And our understanding is, Dawna, correct me if I'm wrong, is that if you have plan F in 2020 and you continue on that plan through 2025 or then you are going to be able to keep that plan if that's what you want. But if you were to relinquish it and go on a B, for example, 1 year, then my understanding is you wouldn't be able to necessarily jump back onto a plan F. So it's just something that if you zoom in on plan C, well, my C example was bad, but if you zoom in on plan C, F, or F prime, and that's what you desire, then just remember that if you, in the future, if you want to make a different choice, then that one may go away. And that may be okay with you. One reason that we really like to go ahead and point this out is because, you know, agents may say anything. And we've got some great agents in this county. You're going to encounter some great agents online. But you could encounter an agent that if you went in 2019 and you said, I want to buy a plan F, like BJ's example, BJ's on Medicare, he wants to do a plan F next year. That agent may tell you, oh, they're not going to be selling that anymore. You can't get that. Well, in 2019, you can. So you just want to know that if you're being told something that sounds a little fishy or contradictory of what you learned in here perhaps, then probably you're going to want to explore that. Pick up the phone and call your SHIIP coordinator out of Raleigh, call Dawna, your local coordinator. If somebody's telling you something fishy and seems to be contradictory, then you want to check it out. And you're going to walk away from here today with tons of resources to do that. But we would like for you to know that you have until January 2020 if those are the plans that are desirable.
Yeah, we can assist you with your comparison of Medigap plans. We can't enroll you in one here through our office because that's sold through private agencies, but we can show you the comparisons. Like she said, every F plan has to cover the same exact thing, but you'll have plans that range from $100 premium to $500, and we can click on those and show you what the difference is. So, and if you're entertaining the thoughts of enrolling in one of those plans, you'll have the background information when you contact these agents, and you can say, hey, well, this is what the price is quoted, and these are the things it says you offer, so they can't tell you one thing. You'll have that information with you. So that's another service we provide here as well.
So, thank you. So on the SHIIP website, and that in the SHIIP brochure, it mentions the SHIIP website. There's a ton of information and resources, and one of the things that I really like is very helpful if you are looking at making a Medigap or supplement decision. You're able to click on and look at a copy of this comparison guide. My guide's out of date. This is a 2017 copy. I'm not sure about the ordering of it. You can order it, but I do know there is a link, and I think it's even on the homepage if you want to look at this. And even if you want to take advantage of what Dawna has offered, and believe you me, when I'm making my decisions, I'm probably going to be picking brains here too. But even if you want to do that, you may still want to check out this resource, because it will tell you at a point in time, it gives you a little bit more information about the standardness of the policies, but it also will give you some additional understanding about maybe where to reach out to purchase those policies. And the SHIIP website is not, again, it's not there to recommend and say, this is what you need to do. It's to educate you and to help make your navigation of this just a little bit easier. So I love the fact that they've got a real quick link to this document. A secondary coverage option, which is kind of like the Medigap policies we just talked about, you may have some other opportunity for secondary coverage. So this is where we really want to stress to you how important it is to find out what you have available to you, either through your former employment, maybe even a couple of employers back, if you've got some sort of retirement benefit with them. Find out what your options are for any sort of assistance with coverage. Low-income individuals may have Medicaid that will operate as a secondary coverage to them with original Medicare. I mentioned the TRICARE for Life for some military retirees if they have that. Federal and state employee retirees have some plans in North Carolina that are available to them. And then your employer group health plans. I know, for example, with the county, after so many years, you had access to plans, and it may be that at one point that was only until age 65. But there may be a window for you to continue something with some of your former employment. Find out what that is. And we're not going to know all those answers. We're not going to know necessarily what your options are or what your rights are through that employment. So I would just point blank ask, I'm going to be retiring. I know traditionally my health insurance ends here. What type of options are there for me beyond that? And with your spouse's plan as well. with your spouse's plan, what right do you have to access anything through that? I'll use my personal example. I wasn't a state retiree, but I have access to that through my spouse. So when I'm 65, then I will be, looking at that about retaining that I pay for versus, maybe a Medigap policy. So that's something that I want to look at. I can't automatically assume that this is better. There's no automatic assumptions in this world. Some employees do offer a variety of options, again, to explore it. And so each individual wants to understand that. One example, where it says here in that third bullet about some offer cash payments to allow beneficiaries to purchase their own coverage. There are some employers out there that's saying, if you retire with us, we're going to give you $500 a month. But how you have access to that $500 may be important. For an example, our understanding of Baxter Healthcare retirees is that they have an exchange. And they have all the same choices that we have as far as, do you want a Medicare Advantage plan, and again we'll talk about that in a minute, or Medicare supplement policies. But if they want help with that, if they want some financial assistance from their retirement relationship with Baxter Healthcare, they have to enroll for those things through their system. And if they don't enroll through their system, they may lose the benefit of that for that year and not get that financial assistance, or they may relinquish their right to that financial assistance for their life. So how your relationship with your employer is set up and what you have access to is important to understand. Are there any caveats with it? Are there any requirements that they place on me in order to be able to take advantage of that? May not apply to anyone in this room, may apply to your neighbor, may apply to someone. And you say, I know you need to find out about that. You need to go talk to your human resources professional and find out about that. So on this slide, then it talks to you about some different possibilities that you may have some secondary coverage options through your former employment or your spouse's former employment. Okay, Medicare Part C, what it's known as, is the Medicare Advantage plans. So, again, if you look at this illustration on the back, this is a conscious decision that you will be able to make. Medicare Advantage plans are just another way to get your Medicare coverage, because all the Medicare Advantage plans are going to cover, at a minimum, everything that original Medicare Part A and Part B cover. Traditionally, they're going to have some extras, but they're at a minimum going to cover this. They're still part of the Medicare program, but they are ran by private companies. So if you choose a Medicare Advantage plan over, you'll enroll for Part A and Part B, but then you'll make your Medicare Advantage relationship. So if you go with that, number one, you can make a different decision next year if you need to. Okay, so it's not a lifelong decision, and that's one thing that I find really comfortable. You have a general enrollment period every year that you can make different decisions, because your situation is going to change throughout the years. So you'll be able to make a different decision. But if a Medicare Advantage plan is looking good to you, then you are going to want to explore it, and then you can rest easy just knowing at a minimum it's going to cover the same things that Part A and Part B cover, but then also recognizing that it is ran by private companies, so you'll be establishing a relationship with that company. You'll be getting all your communication from that company related to this. One thing is, with the Medicare Advantage plans, one thing to understand is that when you're looking at Medicare Advantage plans, then you can only look at the ones that are serving McDowell County. what is serving Burke County and what's serving Bungay County may be the same. There may be some overlap, but you have to enroll for something that serves McDowell County. And when you look at those, they're going to tell you what their premium is. So they say you can come with us at 0 additional cost. But what you need to understand is that $135.50 from your Social Security check that you're paying for Part B, Medicare is transferring to that company. So you're paying at a minimum $135.50 for that coverage. Some of them will tell you it's only going to cost you $100 a month. So it would be $100 plus that $135.50. But again, they're going to cover this as a basic, but they may have some additional things. And so there may be a variety of reasons why that may be attractive to you. A Medicare Advantage plan is attractive to a lot of people for a lot of reasons. But our role, I wouldn't even attempt outside of my SHIIP volunteer role to advise you that one is better than the other, because it's individualized. It's individual situations and what your wants and needs are, and what you know about your immediate medical future. Those make a difference in what's the best thing for you. But there's a lot of reasons that people find one more attractive than the other, and we'll talk about that a little bit. But just don't be deceived. If you do a Medicare Advantage plan, you're paying at least $135.50. You may not pay more than that, or you may. You can disenroll from a Medicare Advantage plan during open enrollment, and we are in open enrollment right now. So I think it's December 7th. So they want to make a different choice before that date for what their coverage is coming up January 1. We encourage everybody to do a comparison every year. And that may sound huge, but once you investigate with your individual situation and use your SHIIP resources and your SHIIP personnel for assistance, and your agent, if you have a good agent relationship that you trust, if you utilize those, then hopefully it won't be as daunting every year. It's not such a daunting task every year as it is when you're initially going through these decisions. You'll need to learn what the changes are on the choices that you have for the upcoming year. What changed about my Medicare supplement plan or my Medigap plan? What changed about the Medicare Advantage plan? How much did the copay go up on Medicare Part B? I'm on original Medicare. Are those figures going up real high this year? Maybe this is the year I want to look at a Medicare Advantage plan. So those are all individualized things that you're going to want to consider every year. Another thing that you're also going to want to do is this third major bullet is they have a network of hospitals and physicians. When you seek Medicare treatment from original Medicare, those facilities have to accept Medicare. Well, we know that the greatest majorities accept Medicare, but there may be a few physician offices that don't. They want a direct pay situation or something. So just as you know, with your employer group health plan, most all of us have come off group health plans that were members of networks, like the Blue Cross Blue Shield network or the ABC company network. You need to make sure your doctor is in that network in order to get the richest benefit from your coverage. Well, you're going to want to do that same thing with your other decisions. You're going to want to do that with if you choose a Medicare, a Medigap plan, a supplement, you're going to want to make sure that they don't have any concerns about the physician that you choose, traditionally not, but you're going to want to make sure. But especially with your Medicare Advantage plans and your prescription drug plan choices, you want to make sure where you're going to be able to get those services. And that could change from year to year. Usually doesn't change dramatically, but it could change from year to year, just like our employer group health plan. You know, and everybody remembers when the Mission Health System and Blue Cross Blue Shield had their debacle last year. That can happen at any time. And the Blue Cross Blue Shield was just a huge number of providers that were impacted by that. So generally, it may be small and it may not be your provider, but whatever you're looking at, do they cover where you want to go? And if they don't, but they're still attractive, are you willing to switch? You need to confirm that every single year to make sure that that is something that is still good for you. Individual relationship. Again, Dawna shared earlier, the SHIIP representatives are here to help you walk through some of that. They want to help you because we want to make sure that you're making really good decisions for yourself, but not to tell you what to do. So if there's just a piece of this that you're getting bamboozled about, any part of what we're talking about today, then you certainly can call the Raleigh office, call here and say, is this something that you can help me navigate and actually enroll for? Or is this something that you can point me so I can understand it a little bit better? Don't ever forget that resource. Now we talked about that the types of plans for Medicare Advantage plans, they vary by county to county. And I've also got an old sheet just as an illustration about what was available in McDowell County at a particular point in time. And so we had 1 Aetna, we had 4 Blue Cross Blue Shield, 2 First Medicare Direct, about 5 Humanas it looked like, 4 United Healthcares, a WellCare. So these are the policies that, and this is an old piece of information, and I'm gonna try to see if I can find a new one. But there will be either on the SHIIP website or on the Medicare, the CMS website, what Advantage plans are available in what counties for 2019. And then that way you can explore those individually. But this chart, having access to your chart, gives you this little glimpse in time, like we're seeing the other things in here, the chart for the supplement policies. And it can tell you what type of a plan they are, if they're a preferred provider plan or if they're an HMO. And I'm not seeing any HMOs for this old chart, and how much they cost above and beyond your $135.50. And then you would want to, so once you zoom in on something that looks like it might be attractive for you, then you explore their network and make sure that they're going to cover the facilities that you want. So again, that's if you're looking at the Medicare Advantage and you want to explore that option for you for the upcoming year. So Medicare Advantage plans, another thing that they have, and it's like I talked to you about the supplemental, the Medigap policies, they can offer supplemental benefits that are attractive to you, like vision coverage or dental coverage, etc., etc. In 2019, the Medicare system has allowed them to expand some of the things that they can offer, as long as they're still used to diagnose, prevent, or treat an illness or injury. So, for example, some of the Medicare Advantage plans may offer some additional things like adult daycare services, if those are needed for you, for your situation. Home bathroom devices, things that are helping with your safety. If you're a little, so these Medicare Advantage plans are going to get to offer a little bit extra if they choose to this upcoming year. So sometimes that impacts what their premium is. So that's another very valid question if you're shopping Medicare Advantage plans, is what do you offer above and beyond what original Medicare offers? And then you can decide whether or not that's something that's valuable to you. That is something, if they do offer it one calendar year, they may not offer it the next calendar year. So again, you want to, anything they do above and beyond original Medicare, then you just want to make sure that it's in place again for the next year if that's something that's important to you. We did talk about, it's for McDowell County. So if you move that coverage Guys, when you move, if you move across the line to Burke County, then you need to take care of terminating that coverage and securing your new Medicare Advantage coverage in Burke. Now, that same company may be in Burke, and you can have a conversation with them, and there may be an easy transition. But if you move, then you have different choices. Anything outside of what's offered in McDowell County. So, you know, I told you one of them's Humana, one's Blue Cross Blue Shield. Well, Burke County or Buncombe County or, you know, in Newbern, they may have a Humana plan too, but it might not be the same thing. It probably won't be the same thing, and they're probably going to have different providers. So when you go, if you move, just a negative information to hold on to. I don't think any of us are going anywhere. But if you move, you may also have friends that move. They need to know, if I'm on a Medicare Advantage plan, I've got to take care of business.
And what you're talking about there, to clarify, would be that I live here, but I can get medical attention in Asheville or Buncombe or Burke or any of those. Correct?
Correct.
So that it's simply based on my home address.
That's the policy that you have, and who you deal with is based on your home address.
Okay.
But what they cover, you're gonna, you know, the provider that you love in Buncombe County, just check, make sure that they're in that plan. And the chances are they are.
Right.
I mean, they want to sell in McDowell County, so they're going to try to make sure that they have decent coverage where McDowell County people like to go.
Okay.
It's just not something we can take for granted. And then I don't think that, I'm not aware of any that provide out of the country coverage. So if you're ever choosing to go out of the country, then you're just going to want to make sure that you dot your I's and cross your T's on that. Generally, you'll have some sort of coverage out of state, but not necessarily out of country. And when I'm saying that, I mean Medicare as well as Medicare Advantage plans. So if you're going out of country, make sure that you educate yourself on what's available to you. So you can enroll in a Medicare Advantage plan during that initial enrollment period surrounding your 65th birthday. You have an open enrollment period from October 15th through December 7th. That'll be here before we know it. So anybody that's already on Medicare that needs to make a change, this is the type of year that they're shopping and educating themselves on what they need to do. For somebody that's not on it yet, you're trying to prepare for your initial enrollment period. There, again, we talked about there's some special enrollment periods for Medicare Part B and Medicare Part D, the prescription drug coverage, and those special enrollment periods are generally tied to your the group health plan that you're coming off of. But you'll also have a special enrollment period if you move to a different county or state. So you have a window of time to take care of that business, but if you're on a Medicare Advantage plan, you still need to take care of that business. And there are also some times that you can enroll in a Medicare Advantage plan if you suddenly qualify for extra help. Now, we talked about there is some extra help available, and we'll look at that handout for Part B. But we'll also talk about there's some extra help that's available for Part D, the prescription drug coverage, if you qualify. And there are different qualifications and different places to go to check your qualifications. But sometimes if you know, all of our situations change. You may not qualify for 10 years, and then all of a sudden you do because your situation changed. And if you suddenly qualify during the middle of a year and you file for that assistance and you get it, then you will get an opportunity to have a special enrollment period so that you can make decisions that fit your new situation. Just hold on to that nugget if you ever need it. This slide is just really good as just kind of an educational piece about the differences between original Medicare, which is Part A and Part B, and the Medicare Advantage plan. They both cover Part A and Part B. We've said that repetitively. But the Medicare Advantage plans, they may have some additional benefits. And those are things that you just need to check out and ask about. Those are things you may or may not pay additional for. But those are things that may be attractive for you. If you're coming up upon a year next year that you're going to be having a whole lot of dental work, that might be something that you want to look into. In original Medicare, you have a choice of doctors and hospitals that accept Medicare and accept new Medicare patients. The Medicare Advantage plans, they are approved by Medicare. All these companies that are on this spreadsheet, they're approved by Medicare. But they do have the networks, and that you need to check those networks. Medicare has a network. It's huge, but they have one. These plans have a network. You got to check them out. On original Medicare, a lot of times you have a supplement through your employer or your former employer, or maybe you've purchased a Medigap plan that helps you pay for your deductibles and co-insurances. In the Medicare Advantage plan, you're also probably going to encounter some deductibles and co-insurances. That's again when you just need to look at those. Some of them may have zero copay for your family physician. Zero. And that may be attractive. That may, if you have to see your regular family physician on a regular basis, that may be a huge monetary thing for you. And that's where you just have to look at them to see what they offer. In original Medicare, traditionally we all have Medicare A because we paid into the system all the years we worked. So we don't have to pay additional for that. We do have to pay additional for Part B. And that additional premium helps pay a Medicare Advantage plan if you go that route. One of the things that in the open enrollment period that I want a tiny bit backtrack to is that if you make a decision to go on a Medicare Advantage plan before December 7th of this year, say, or during your, during that open enrollment, and you have buyer's remorse in February, then you're going to have an opportunity to make a one-time change to go back to original Medicare after the coverage has went into effect. They're allowing that for 2019, that you're going to get a one-time window. So let's say that January 1st has come and gone. I got this Medicare Advantage plan. I'm having remorse because I thought my provider was in it. He's not, or whatever. You can have a window of time, and I think it's to February 15th. No, it's to March 31st. You can do a one-time change, and you can either go back to original Medicare or you can go to a different Medicare Advantage plan. But only once, and you need to initiate that. So it's just good to know that you've got a little bit of buyer's remorse, one-time window, if you really need to use it. But you need to initiate that. So it's just something, again, just something to hold on to. Traditionally, after January 1st, you're in. But you do have a small window of time to change. But you can't. Prior to 2019, you couldn't go to another Medicare Advantage plan. You could only go back to original Medicare during that window. But now they're allowing. So somebody may tell you, no, you can't choose another Medicare Advantage plan. You used to couldn't. In 2019, you can. But only one time. You only get to make that change one time. Okay, prescription drugs, Part D, and I hear this referred to as Part D, Part D, Part D way more frequently than I ever hear it referred to as prescription drug coverage. So just know that. Anybody that is covered, and again, this illustrates really good for you, this back page of this handout. Anybody that's covered by Part A and Part B can join a Part D plan. If you take a Medicare Advantage plan, then they have prescription drugs in them. And that's one reason some people find a Medicare Advantage plan attractive, to be honest, is because instead of dealing with Medicare and my supplement coverage and this Part D company that I'm purchasing my prescription drug coverage from, I'm dealing with them. So that's one thing that's attractive. But it's not that's not the only reason to choose that. And hopefully I've been able to convey that. There's several things to consider, but that is one reason, because they get all of their explanation of benefits. They're dealing with one company for their prescription drugs, their hospital, and their doctor claims. So that's one reason that that's attractive. So you can't purchase a Medicare Part D prescription drug coverage with a Medicare Advantage plan, but there's no need. You may like the looks of one of these better than what they give you, so that's something to consider. Now, there is a real small window of some Medicare Advantage plans that don't have prescription drugs that do allow this, but none of those are offered in McDowell County. So and they're not offered prevalently anyway. So we just like to say, if you're choosing one of these, then you do not pick, you don't have the choice for a Medicare Part D. You will have some prescription drug coverage. These are sold, the prescription drug coverage plans are sold by private insurance companies, and they require monthly premiums that you will be paying. They could be small, they could be large, depending upon what it is that you choose. Each plan covers a group of prescription medications, and that's called the formulary list. Hopefully that word rings a bell from your employer group plan, because you want to make sure that your formulary, the prescription drug that you take, that costs you $90 now, but if you didn't have coverage, it would cost you $350. You want to make sure that they're covered under here if you choose this, and under here if you choose this. And that can also change from year to year. Maybe not dramatic, but it could. So that's something you'll want to look at, especially those prescription drugs that are very important to you and that have the potential to be very costly. Some of these plans may even have a deductible. So some of them just go by copays, and some of them may also have a deductible and then some copay situations. So you're just going to want to look at these. Part D is voluntary. You don't have to take it. You don't have to make that decision when you first turn 65. But if you don't take it, and you're not on an employer group health plan and have prescription drug coverage somewhere else, and you later qualify for a special enrollment period, if you decide you want to take it 5 years later, then you pay the premium with a penalty. It's Part D, prescription drugs, and Part B are both things that you can delay decisions on. They're voluntary, but if you delay your decision without a special enrollment situation, you are going to have a penalty. Again, it's $13 a month right now, something for you to concern yourself about. That's an individual choice and decision. There is, for somebody that takes many prescription drugs, this can be very daunting, making this decision. So this is another point where your SHIIP relationship comes in really handy. In your handouts, there is a plan finder tool that looks like this. And our Senior Center personnel, under Wayland and Dawna's guidance, some of them help key in some of the drugs, but this form will help them help you if you would like some assistance. You can go on the SHIIP website and you can go into this tool finder yourself, and you can enter your information and include a list of your prescription drugs and enter them into this system, and that system will tell you these companies look the best for you because they're the cheapest for the drugs you take, or they have the drugs you take, or this plan looks really great for you but it doesn't cover this one, and it sorts them. But that can still be confusing sometimes if somebody's not real computer savvy or something. Maybe they find that confusing, or in my opinion, if you've got some help and it's free and they can help you sort it so you can zoom in and look at a narrow group of plans, then that is helpful. These are the 5 that cover what you take. All the rest of these either cost significantly more or they don't cover your drugs. then that's good to know. It helps you a little bit narrow it down. So they will be glad to help you with this when you're shopping. If you will completely fill this form out, you put it in an envelope if you like, leave it at the front desk, and they will enter it in the system, and they will call you. And they will either talk to you on the phone if it's some pretty clear things, or if you'd like to come in for an appointment and sit down and look at some things. Dawna and Wayland are the two primaries that meet with the individuals. We have some other staff that key some stuff in just to help the process, because this is the open enrollment season, and there's a lot of people that are trying to take advantage of this help right now. Again, you can do it online yourself. Go to the SHIIP website, but keep this form to remind yourself that if a little bit of help narrowing it down would be good for you, then they'll be glad to initiate the experience for you or walk you through it. You just need to complete this, leave it at the front desk, and they will get back with you. If you've not heard anything within a week or two, you may want to call in and just say, I'm touching base, but it seems to go very smoothly, and a lot are very appreciative. Now again, they're not going to tell you what to take, so you might as well not even ask. So I'll use Dawna's example so much as there was a citizen that asked for their help, and they were able to illustrate to her where she would save over $500 a year by going with a different plan. And she just didn't want to change. It's her decision. It's her decision. They point out, here's your choices, and this is how much they'll cost you over a year if your prescriptions stay this way. But it's your decision. And that's the way that it should be, so that you can have confidence that they're providing you with good information. So fill this out if you could use some assistance with that, or if you don't need it now, just remember it, share it with others that you know may qualify. Great benefit, in my opinion. Okay, so I mentioned earlier that there is some financial assistance available for some people, and you have a handout that looks like this. So the first one is the assistance that's available with your Part D, which is the prescription drug, and it gives you, this was your 2018 requirements. So if you feel like you're close to fitting into one of those categories, then you want to pursue this. You want to look and see whether or not this will either pay for, it can eliminate your monthly premiums for Part D if you're under that original Medicare umbrella. It may reduce your prescription payments, and sometimes, again, it allows you a special period of time to enroll. The Social Security Administration is the one that determines this. Now, the local SHIIP personnel can help you get to apply for this, but the Social Security Administration will be making the decision on whether or not you qualify, and give you that notification. But also on this handout, I want to go ahead and touch on the I told you backwards, didn't I? The bottom one is with Medicare D. The top one is with B. The assistance that you can get with B. And it tells you that, so I apologize that I mixed them up, but it does tell you that. This low-income subsidency here provides assistance with Medicare Part D. And again, the SHIIP coordinator here can help you with that to apply for that. So just remember these, and that the extra help is available. The other coverage, the other special help is through social services. They initiate that. So if you come into a situation where you feel like you may qualify for these, or you just want to explore it, and it's not really clear to you at that time, then just call a SHIIP counselor or call Dawna here to So where do I need to go to apply for this extra help? May not need it ever, but if you do, it's good to know. When can you enroll for a Part D plan, the prescription drug plan, during that 7-month initial enrollment program? During the open enrollment period that we're in now, if you're already on Medicare, in the Medicare umbrella, you have an open enrollment period where you can make a decision now, and the coverage begins January 1st. So people that are currently on Medicare are making decisions about, do I stay on the original Medicare? Do I go to Medicare Advantage plans? Do I switch Medicare Advantage plans? If I'm on original Medicare, what do I want to do about my prescription drug coverage? So there's several things depending upon how you want to move forward that they are exploring right now for the effective date of January 1. Okay, now this slide illustrates a little bit more about the differences between the Medicare supplement policies and Medicare Advantage plans. And this again is where I find it really helpful. This kind of helps you keep it in mind that this is your Medicare supplement policies and this is your Medicare Advantage plans. Both of these are ran by private companies. So your relationship will be with those companies as far as what do you cover, how are you processing my claims, etc. The Medicare supplement policies, their government oversight is the state, but they are also responsible to follow the federal laws. And the Medicare Advantage plans, they have to be and are approved by Medicare. So that does give you a little bit of security knowing that they're aligning with these at a minimum. This plan covers your gaps in these coverages, like your deductibles, coinsurance, and your co-payments. The Medicare Advantage plans cover all of the Part A and Part B, but they can also cover some additional things that original Medicare doesn't cover, like vision and dental, etc. They may have those, and they may have some additional things that we talked about earlier. And most all of them include the prescription drug coverage, and those in McDowell do. You have to have made a Part A and a Part B decision initially in order to be able to transition to a Medicare Advantage plan, because again, your Part B premiums that you agreed to are being transitioned to this company to assist in paying for that if you choose a Medicare Advantage plan. So you are paying and are responsible for a premium no matter what your decision is between these. This last slide is another illustration like this one. It just kind of simplifies it just a little bit, but it's the same thing. But it illustrates Part A and Part B again for you, and you can add a supplement and you can add Part D. You don't have to take that, but if you don't, again, and you want it later, you will incur a penalty. Or your choice is a Medicare Advantage plan, and adding that Part D, again, as I told you earlier, we traditionally don't even like to mention that because it doesn't really apply to the plans that are available in McDowell County. So that's why this illustration is a little bit clearer for what we have here in McDowell. You will have prescription drug coverage with these McDowell plans. You cannot have this and this together. Both slides are illustrating that for you. This or. And then this last one is just, again, the resources. Feel free to copy any of these down. I'll leave this slide up for just a few minutes. But again, these handouts have all of this at your fingertips within the information that's provided here. And I want to go over a few of our handouts just a little bit more thoroughly, but that does conclude the slide presentation. The handout that looks like this, I usually mention it early in the presentation, and I apologize. I love this handout. But this handout I highly recommend that you go ahead and take a look at this and read it, because it gives blurbs on everything, the different options that we've talked about. But they're worded in such a way that I just find that they're really valuable, and they will help solidify a little bit more about what we've covered during the presentation today. But they have additional information. For an example, on the second page, at the very top of the page, the second bullet, it reminds you that as a new Medicare beneficiary, you're entitled to a one-time Welcome to Medicare visit with your primary care provider within 12 months of the day that your Medicare Part B becomes effective. So for those of you that aren't on Medicare yet, and that's coming up for you, to me, that is a huge benefit that probably a lot of people don't recognize to take advantage of. This helps establish your Medicare relationship with your primary care physician. Hey, I qualify now for this. This is how my claims are going to be being paid. This is the different coverages that I'm going to have eligibility to take advantage of with the Medicare plan. And then there's, a lot of things that they highly encourage that you do take advantage of. And we've got a brochure on that I'll talk about. But this is just a really good handout that, again, I highly recommend you look at. And it's got a lot of the resource and contact information at the back where it says stop, get help. So highly recommend you go ahead and take a look at that and refresh yourself with that from time to time. The brochure that I just mentioned about Medicare, they cover so much more in preventative services than is generally known. Perhaps because some of these things were not traditionally covered by Medicare in years past. And all of us think about Medicare that our parents had. And perhaps even that some of us, our grandparents may have had. That's what we kind of relate to and think about. But Medicare strongly encourages you and wants you to take advantage of these preventive services. And when I would give education sessions on employer group health plans, I was pushing these services. Why? Because if you have a cancer screening and they catch something in the real early stages, then the chances are so much better for your rate of survival, or that what you have to go through is less invasive. But that also means it's going to be less costly for the system. So as on an employer group health plan, we're talking about keeping our employer group health plan healthy. But now we're talking about keeping Medicare healthy so that we have it down the road. We want to keep Medicare healthy so that our children are able to have this opportunity as well. So lots of reasons, but those are some primary reasons. Strongly urge. Nobody likes to go get some of these examinations, but a lot of them are way less invasive than they used to be. And they have a lot of different alternatives. So certainly, as soon as you're eligible to take advantage of some of these, I know that we have some really stubborn men, and they think that they don't need any of this, but we women that love you want you to take advantage. So please give that consideration. This brochure references once again the extra help. So it's got a little bit more detail. There's a few more bullets. So this is related to this brochure this handout that we went over just a few minutes ago. But it gives a little bit more detail. And as I stated earlier, if you forget, just call the SHIIP coordinators, the SHIIP office, and they can point you in the right direction. They can either help you apply for this extra help, or they can get you to the best resource to do that, to make it as easy on you as possible to find out whether or not you can qualify for this help. A couple of things that I want to mention. There are some coverages under Medicare that you may have to go through a hoop for, or get your physician to go through a hoop for, but they're not as problematic as you may have thought. or that you may not have realized they covered. And one of those is durable medical equipment. I think even on a lot of our group health plans, a lot of times those things were not covered, or they were very difficult to get. Assistance with crutches and walkers and oxygen. You know, a lot of those have been more challenging in the past, but Medicare wants you to have access to the durable medical equipment that you need. Your physician needs to clearly illustrate your need for those items. The same thing with home health care. If you have Medicare, then you are able to take advantage of some home health care benefits if you qualify. And again, that's your physician saying this is what you need and communicating that to the Medicare system or your Medicare Advantage plan, communicating that. So when you're thinking about that, you're also, with home health care, you're also thinking about intermittent skilled nursing care. You know, we talked about that there is some coverage that if you come right out of the hospital for that, well, what about those situations where you really need that, but you haven't had a hospital stay? There may be some coverage for that if your physician is able to help you illustrate that. Physical therapy, speech language services, etc. Nuggets for you to remember. Hey, my doctor's talking to me about that. I remember that Medicare 101, they talked about we may have something there. I need to find out about that. So you can take advantage of what coverage that you can have. With the last thing kind of in that category is hospice. A lot of people don't understand how hospice works. And if you qualify, if you fit that criteria for hospice services, which generally is a terminal situation, a situation that your physician believes is a terminal situation, then Medicare provides 100% coverage for some hospice care. But again, it's working with your physician to get that established and in place. One thing that is huge to me is that if you are under hospice care, then your prescription drugs that you need related to that, that's covered under that same umbrella, that hospice umbrella. So it kind of separates some of that out. And when you're talking about terminal care, a lot of times those medications that are needed to treat that are exorbitant. So if it's a hospice care situation, again, just a nugget to hold on to if you or someone that you love, may be facing that situation. Earlier in the presentation, I talked to you about sometimes in my past, some individuals have come to me and said, I've already paid my hospital bill, but I have this bill from this doctor. I've never even heard of him before. I don't understand it. And in a great many instances, that is a legitimate bill. It's a physician during your hospital stay. You were out of it, so you didn't meet them. But what we do want to communicate is that there is a lot of fraud that's going on in regard to all health care and all health care claims and all insurance companies, but it is rampant in Medicare. So they can't do it without us. They don't know that we didn't receive help from that physician, or that we didn't have 20 visits to that physician last year. So when we receive our summary of benefits, or we receive an invoice that we're confused about, then it's going to be our responsibility, and it is our responsibility just as citizens to try to find that out and determine whether or not that is a legitimate expense. In my past work life, one position that I had, there was a huge concentration in education on fraud in the managed care system in North Carolina, which also relates to Medicare, and it blew my mind. I mean, like one instance, over $13 million in falsified claims in North Carolina. And that sounds huge, but that was one of multiple examples in, a few year time frame that was discovered and was addressed in North Carolina. So we have a responsibility, and we want those addressed. So there's several things that you can do. If you suspect fraud, but you're a little bit leery about how to move forward, the SHIIP counselors can help. Go to your SHIIP website, call a SHIIP counselor, call the local office and your local coordinator and say, where do I turn to? You can, the Medicare website, the CMS website, they're going to have numbers. If you don't know, you're not being ugly if it turns out that claim was legitimate. But if you truly feel like, I don't believe I received that service or that many times of that service, for them to check it out, and they possibly discover a multi-million-dollar fraud, then, because it's not just you, whatever they're doing to you, they're doing to somebody else's claims as well. So to me, that's huge. You can tell that I'm passionate about this, but it takes us all in order to check out what we have. And if you are not confident moving forward yourself, get help, at least report it, let somebody else in the field take a look at it and move forward and investigate those claims. I appreciate you coming. You are welcome to come back to another Medicare 101 seminar if you'd like. Remember to take advantage of the tool finder for your Medicare Part D, your prescription drug assistance, if that would be valuable to you. But as Dawna pointed out earlier, there's lots of other things that SHIIP can help you with. So ask, is this something, because if they don't know, they're either going to be able to get the answer for you or they're going to be able to point you to a resource.